name is Dr. Elise Siklick, and I'm the Medical Director of Inpatient Rehabilitation at Gaylord Hospital in Wallingford, Connecticut. My particular area of interest is in the rehabilitation of stroke survivors as well as survivors of brain injuries. We're going to spend a few minutes talking about our Young Stroke program, which is a segment of our overall stroke program here on the inpatient units here at Gaylord Hospital. The name may indicate that our Young Stroke program is geared towards a younger population, and it does tend to have patients in it that are younger. However, to qualify to be in the Young Stroke program, you have to have been either a primary caregiver, a student, or have been working at the time that you had the stroke, and that you may have goals to go back to work, once again be a primary caregiver, or go back to school. For example, if there's a 70-year-old man who was working at the time of his stroke, he would be a good candidate for our Young Stroke program. The Young Stroke program tends to focus on lots of activities if the patient does have these goals of returning to work, returning to school, or returning to being a primary caregiver. Things such as a young parent, with children at the time of their stroke that may need to be able to do activities to help care for their children would be activities that would be worked on by different members of our rehabilitation team. The rehabilitation team is led by a rehabilitation specialist, otherwise known as a physiatrist, and works with physical therapy, occupational therapy, speech therapy, therapeutic recreation specialists, as well as rehabilitation nursing specialists to address the multiple areas of deficit secondary to the stroke. Additional members of the team can include psychology as well as nutritionists to overall look at the different aspects of the person's deficits following the stroke. The inpatient program is one part of the continuum of care in the course of the patient's recovery after stroke. We get the majority of our patients from acute care hospitals, and depending on what the resources are of that patient in the community as well as their progress following a stroke, some patients are able to be either discharged directly to the community. They may also need an outpatient program, and they may also need some additional services at a subacute environment prior to returning to the community. After patients leave our inpatient program, they are discharged with ongoing physiatry follow-up to continuously readdress their rehabilitation progress as well as their ongoing needs. If you have any questions or would like to inquire further about our Young Stroke program or any aspects of our stroke program in general, please feel free to contact the Department of Admissions here at Gaylord Hospital, and we will point you in the right direction to answer your questions and voice your concerns. Thank you.